Welcome back to Road to Nursing License 101. Today, we're diving into 50 essential cardiac Nclex questions, all fully explained with rationales. Whether you're preparing for the Nclex RN exam or just reviewing heart concepts, this video is designed to help you think critically like a nurse and answer confidently. We'll cover heart failure, myocardial infarction, arrhythmias, hypertension, medications, and more, step by step, question by question, so you won't just memorize, but understand the reasoning behind each answer. Make sure you grab a notebook and pen and get ready to test your knowledge and boost your cardiac nursing skills. Let's get started. Question 1. A nurse is assessing a client with heart failure. Which symptom indicates worsening left-sided heart failure? A. Peripheral edema. B. Crackles in the lungs. C. Jugular vein distension. D. Hepatomegaly. Correct answer, B. Rationale. Left-sided heart failure causes blood to back up into the lungs, leading to pulmonary congestion. This produces crackles, dyspnea, and orthopnea. Peripheral edema, JVD, and hepatomegaly are signs of right-sided heart failure. Question 2. A patient arrives at the emergency department with chest pain. Which cardiac biomarker is most specific for myocardial injury? A. Creatine kinase. B. Troponin. C. Myoglobin. D. LDH. Correct answer, B. Rationale. Troponin I and T, is the most specific and sensitive indicator of myocardial damage. Troponin levels increase within 3 to 6 hours after myocardial injury and remain elevated up to 14 days. Question 3. A nurse is caring for a patient with atrial fibrillation. Which complication is the highest priority? A. Hypertension. B. Stroke. C. Bradycardia. D. Hypoglycemia. Correct answer, B. Rationale. In atrial fibrillation, the atria quiver instead of contracting effectively, causing blood stasis and clot formation. These clots may travel to the brain and cause a stroke, making anticoagulation therapy essential. Question 4. Which medication is commonly prescribed to prevent clot formation in a patient with atrial fibrillation? A. Furosemide. B. Warfarin. C. Metoprolol. D. Digoxin. Correct answer, B. Rationale. Warfarin is an anticoagulant used to prevent thromboembolism in atrial fibrillation. It reduces stroke risk by inhibiting vitamin K-dependent clotting factors. Question 5. A nurse is assessing a patient with cardiac tamponade. Which findings should the nurse expect? A. Hypotension. B. Bounding pulse. C. Hypertension. D. Bradycardia. Correct answer, A. Rationale. Cardiac tamponade occurs when fluid accumulates in the pericardial sac, compressing the heart and preventing proper filling. This leads to decreased cardiac output and hypotension. Other signs include JVD and muffled heart sounds. Beck's triad. Question 6. A client with hypertension asks why lifestyle changes are recommended. Which explanation by the nurse is most accurate? A. They eliminate the need for medication. B. They reduce cardiac workload and blood pressure. C. They increase sodium retention. D. They prevent arrhythmias only. Correct answer, B. Rationale. Lifestyle changes such as weight reduction, low sodium diet, regular exercise, and smoking cessation reduce vascular resistance and cardiac workload, lowering blood pressure and cardiovascular risk. Question 7. A nurse is caring for a client receiving digoxin. Which symptom indicates digoxin toxicity? A. Blurred vision with yellow halos. B. Hypertension. C. Increased appetite. D. hyperactivity. Correct answer, A. Classic signs of digoxin toxicity include visual disturbances, yellow halos, nausea, vomiting, bradycardia, and arrhythmias. Electrolyte imbalances such as hypokalemia increase the risk. Question 8. A patient with myocardial infarction is receiving oxygen therapy. What is the primary purpose of this intervention? A. Reduce blood pressure. B. Increase oxygen supply to the heart muscle. C. Prevent pulmonary embolism. D. Reduce blood glucose levels. Correct answer, B. Rationale. Oxygen therapy increases oxygen delivery to ischemic myocardial tissue, helping reduce myocardial damage during a heart attack. Question 9. Which assessment finding is most concerning in a patient with right-sided heart failure? A. Crackles in lungs. B. Jugular vein distension. C. Cyanosis. D. Cough. Correct answer, B. Rationale. Right-sided heart failure leads to systemic venous congestion, causing JVD, peripheral edema, and hepatomegaly. Question 10. A nurse is teaching a patient with angina about nitroglycerin use. Which instruction is correct? A. Swallow the tablet whole. B. Place the tablet under the tongue. C. Take after meals only. D. Take once daily only. Correct answer, B. Rationale. Nitroglycerin is taken sublingually for rapid absorption into the bloodstream, providing quick relief from angina by dilating coronary arteries. Question 11. Which electrolyte imbalance increases the risk of digoxin toxicity? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypernatremia. Correct answer, B. Rationale. Low potassium levels enhance digoxin's effects, increasing the risk of toxicity and life-threatening arrhythmias. Question 12. A patient reports chest pain relieved by rest. Which condition is most likely? A. Stable angina. B. Unstable angina. C. Myocardial infarction. D. Pericarditis. Correct answer, A. Rationale. Stable angina occurs with exertion and is relieved by rest or nitroglycerin. Unstable angina occurs unpredictably and may not be relieved by rest. Question 13. Which diagnostic test is most useful in detecting coronary artery blockage? A. Chest X-ray. B. Coronary angiography. C. ECG. D. Echocardiogram. Correct answer, B. Rationale. Coronary angiography visualizes coronary arteries using contrast dye, allowing identification of blockages and narrowing. Question 14. Which sign indicates decreased cardiac output? A. Warm skin. B. Confusion. C. Hypertension. D. Bounding pulse. Correct answer, B. Rationale. Reduced cardiac output leads to decreased brain perfusion, causing confusion, restlessness, and altered mental status. Question 15. Which heart valve is most commonly affected by rheumatic heart disease? A. Aortic valve. B. Mitral valve. C. Pulmonary valve. D. Tricuspid valve. Correct answer, B. Rationale. Rheumatic fever commonly damages the mitral valve, causing mitral stenosis or regurgitation. Question 16. Which medication reduces heart rate and blood pressure by blocking beta-adrenergic receptors? A. Lisinopril. B. Metoprolol. C. Furosemide. D. Aspirin. Correct answer, B. Rationale. Metoprolol is a beta blocker that decreases heart rate, cardiac workload, and blood pressure. Question 17. A nurse is monitoring a patient with heart failure receiving furosemide. Which lab value requires immediate attention? A. Potassium 2.9 milliequivalents per liter. B. Sodium 138 milliequivalents per liter. C. Glucose 100 milligrams per deciliter. D. Calcium 9.0 milligrams per deciliter. Correct answer, A. Rationale. Furosemide is a loop diuretic that can cause hypokalemia, increasing risk of arrhythmias. Question 18. Which intervention is priority for a patient experiencing acute myocardial infarction? A. Encourage ambulation. B. Administer oxygen. C. Provide high-protein diet. D. Restrict fluids. Correct answer, B. Rationale. Providing oxygen improves oxygen supply to ischemic myocardium and reduces tissue damage. Question 19. Which heart sound is associated with heart failure? A. S1. B. S2. C. S3. D. S4. Correct answer, C. Rationale. An S3 heart sound occurs due to rapid ventricular filling and is commonly associated with heart failure. Question 20. Which risk factor is modifiable for coronary artery disease? A. Age. B. Genetics. C. Smoking. D. Male gender. Correct answer, C. Rationale. Smoking is a modifiable risk factor that damages blood vessels and accelerates atherosclerosis. Question 21. Which position helps relieve dyspnea in heart failure? A. Supine. B. Trendelenburg. C. High Fowler's. D. Side lying. Correct answer, C. Rationale. High Fowler's position reduces venous return and improves lung expansion, making breathing easier. Question 22. Which ECG finding indicates ventricular tachycardia? A. Narrow QRS complexes. B. Irregular rhythm. C. Wide QRS complexes with rapid rate. D. Absent P waves only. Correct answer, C. Rationale. Ventricular tachycardia originates in the ventricles, producing wide QRS complexes and rapid heart rate. Question 23. A patient experiencing chest pain receives aspirin. What is its primary effect? A. Vasodilation. B. Antiplatelet action. C. Diuresis. D. Beta blockade. Correct answer, B. Rationale. Aspirin inhibits platelet aggregation, preventing clot enlargement during myocardial infarction. Question 24. Which sign suggests cardiogenic shock? A. Warm skin. B. Hypotension and weak pulse. C. Increased urine output. D. Hypertension. Correct answer, B. Rationale. Cardiogenic shock results from severe heart failure causing low blood pressure, weak pulses, and poor tissue perfusion. Question 25. Which condition is characterized by chest pain that worsens with inspiration and lying down? A. Angina. B. Myocardial infarction. C. Pericarditis. D. Heart failure. Correct answer, C. Rationale. Pericarditis causes sharp chest pain that worsens when lying down and improves when leaning forward. Question 26. A nurse is caring for a client with infective endocarditis. Which symptom is most commonly associated with this condition? A. Severe abdominal pain. B. Fever and heart murmur. C. Severe hypertension. D. Bradycardia. Correct answer, B. Infective endocarditis is an infection of the inner lining of the heart and heart valves. The most common symptoms include fever, chills, fatigue, and a new or worsening heart murmur. The infection damages heart valves and may lead to embolic complications. Question 27. Which patient is at highest risk for developing coronary artery disease? A. A 25-year-old who exercises daily. B. A 45-year-old smoker with high cholesterol. C. A 30-year-old vegetarian. D. A 40-year-old with normal blood pressure. Correct answer, B. Rationale. Smoking and hyperlipidemia are major modifiable risk factors for coronary artery disease. Smoking damages blood vessel walls and promotes atherosclerosis, increasing the risk of myocardial infarction. Question 28. Which assessment finding suggests left ventricular failure? A. Peripheral edema. B. Ascites. C. Pulmonary crackles. D. Jugular vein distension. Correct answer, C. Left ventricular failure causes blood to back up into the lungs, resulting in pulmonary congestion and crackles, dyspnea and orthopnea. Peripheral edema and ascites are more common with right-sided heart failure. Question 30. A nurse, a patient with hypertension, asks why sodium restriction is necessary. Which explanation by the nurse is correct? A. Sodium causes dehydration. B. Sodium increases blood volume and blood pressure. C. Sodium reduces potassium levels. D. Sodium prevents heart failure. Correct answer, B. Excess sodium causes water retention, increasing blood volume and therefore raising blood pressure. Reducing sodium intake helps control hypertension and reduces cardiovascular risk. Question 30. A nurse is monitoring a client receiving nitroglycerin. Which side effect should the nurse expect? A. Headache. B. Constipation. C. Hyperglycemia. D. Increased appetite. Correct answer, A. Nitroglycerin causes vasodilation, which often results in headaches, flushing, dizziness, and hypotension. Headaches are a common and expected side effect. Question 31. Which laboratory result indicates hyperlipidemia? A. LDL 180 milligrams per deciliter. B. HDL 60 milligrams per deciliter. C. Triglycerides 90 milligrams per deciliter. D. Total cholesterol 150 milligrams per deciliter. Correct answer is A. Rationale. LDL is known as bad cholesterol. Levels above 160 milligrams per deciliter significantly increase the risk of coronary artery disease due to plaque formation in arteries. Question 32. A nurse is caring for a patient with ventricular fibrillation. What is the priority intervention? A. Administer oral medication. B. Start chest compressions and defibrillate. C. Provide oxygen only. D. Obtain a blood sample. Correct answer is B. Rationale. Ventricular fibrillation is a life-threatening arrhythmia in which the ventricles quiver instead of pumping blood. Immediate CPR and defibrillation are required to restore a normal rhythm. Question 33. A patient reports sudden severe chest pain radiating to the left arm and jaw. Which condition should the nurse suspect? A. Angina. B. Myocardial infarction. C. Gastroesophageal reflux. D. Pericarditis. Correct answer is B. Rationale. Classic symptoms of myocardial infarction include severe chest pain, pressure or squeezing sensation radiating to the arm, jaw, neck, or back, often accompanied by sweating and nausea. Question 34. Which intervention helps prevent deep vein thrombosis in hospitalized cardiac patients? A. Bed rest. B. Early ambulation. C. Fluid restriction. D. Oxygen therapy. Correct answer is B. Rationale. Early ambulation improves venous circulation, reducing blood stasis in the legs and lowering the risk of clot formation. Question 35. Which medication is commonly used to dissolve blood clots during a myocardial infarction? A. Heparin. B. Nclex. C. Aspirin. D. Metoprolol. Correct answer is B. Rationale. Nclex is a thrombolytic medication that dissolves blood clots in coronary arteries, restoring blood flow to heart tissue during an acute myocardial infarction. Question 36. Which symptom indicates worsening heart failure? A. Weight gain of 3 pounds in 2 days. B. Increased appetite. C. Decreased urination. D. Dry skin. Correct answer, A. Rationale. Rapid weight gain indicates fluid retention, which suggests worsening heart failure. Patients are often instructed to report weight gain of 2 to 3 pounds in a short period. Question 37. A patient with heart failure is prescribed ACE inhibitors. What is the primary action of these drugs? A. Increase heart rate. B. Dilate blood vessels. C. Increase sodium retention. D. Increase blood pressure. Correct answer, B. Rationale. ACE inhibitors cause vasodilation, lowering blood pressure and reducing cardiac workload by blocking the renin-angiotensin-aldosterone system. Question 38. Which assessment finding suggests aortic stenosis? A. Loud systolic murmur. B. Weak pulse. C. Syncope during exertion. D. All of the above. Correct answer, D. Rationale. Aortic stenosis causes narrowing of the aortic valve, leading to a systolic murmur, decreased cardiac output, weak pulse, chest pain, and syncope during activity. Question 39. Which nursing intervention is important for patients taking warfarin? A. Increase vitamin K intake. B. Monitor IFR levels. C. Restrict fluid intake. D. Avoid protein foods. Correct answer, B. Rationale. Warfarin therapy requires regular monitoring of INR, International Normalized Ratio, to ensure the blood is not too thin, preventing bleeding complications. Question 40. A patient experiences shortness of breath while lying flat. This condition is known as A. Orthopnea, B. Dyspnea, C. Tachypnea, D. Apnea. Correct answer, A. Rationale. Orthopnea is difficulty breathing while lying flat. It commonly occurs in heart failure due to fluid redistribution to the lungs. Question 41. Which condition is characterized by irregular heartbeat? A. Ventricular tachycardia. B. Atrial fibrillation. C. Sinus bradycardia. D. Heart block. Correct answer B. Atrial fibrillation produces a chaotic atrial rhythm, resulting in an irregular pulse. Question 42. Which heart chamber pumps oxygenated blood to the body? A. Right atrium. B. Right ventricle. C. Left atrium. D. Left ventricle. Correct answer D. The left ventricle pumps oxygenated blood into the aorta, supplying the entire body. Question 43. Which condition occurs when the heart cannot pump enough blood to meet the body's needs? A. Hypertension. B. Heart failure. C. Angina. D. Arrhythmia. Correct answer B. Heart failure occurs when the heart's pumping ability is impaired, leading to fatigue, fluid retention, and shortness of breath. Question 44. Which diagnostic test evaluates the electrical activity of the heart? A. Echocardiogram. B. Electrocardiogram, ECG. C. Cardiac catheterization. D. CT scan. Correct answer B. An ECG records the electrical impulses of the heart, helping diagnose arrhythmias, myocardial infarction, and conduction abnormalities. Question 45. Which lifestyle change helps reduce the risk of cardiovascular disease? A. Smoking. B. Regular exercise. C. High sodium diet. D. Sedentary lifestyle. Correct answer B. Regular exercise improves heart function, lowers blood pressure, improves cholesterol levels, and reduces cardiovascular risk. Question 46. Which sign indicates poor tissue perfusion? A. Warm skin. B. Capillary refill greater than 3 seconds. C. Strong pulse. D. Pink nail beds. Correct answer B. Delayed capillary refill indicates poor circulation and decreased perfusion, often seen in shock or severe cardiac dysfunction. Question 47. Which condition involves inflammation of the heart muscle? A. Pericarditis. B. Myocarditis. C. Endocarditis. D. Angina. Correct answer is B. Rationale. Myocarditis is inflammation of the myocardium, often caused by viral infections, and can impair heart function. Question 48. Which diet is commonly recommended for patients with hypertension and heart disease? A. High sodium diet. B. DASH diet. C. High fat diet. D. Ketogenic diet. Correct answer is B. Rationale. The DASH, dietary approaches to stop hypertension, diet, emphasizes fruits, vegetables, low-fat dairy, and reduced sodium to lower blood pressure. Question 49. Which complication may occur after a myocardial infarction? A. Arrhythmias. B. Heart failure. C. Cardiogenic shock. D. All of the above. Correct answer is D. Rationale. Myocardial infarction can lead to serious complications, including arrhythmias, heart failure, cardiogenic shock, and ventricular rupture. Question 50. Which nursing action is most important when caring for a patient with chest pain suspected of myocardial infarction? A. Encourage activity. B. Administer oxygen and obtain ECG. C. Provide high-fat meal. D. Delay treatment until lab results return. Correct answer is B. Rationale. Immediate management of suspected myocardial infarction includes oxygen therapy, ECG monitoring, and rapid medical treatment to restore blood flow and minimize heart damage. That's it for our 50 cardiac Nclex questions. Yay! I hope this session helped you strengthen your cardiac knowledge and feel more confident for your Nclex RN exam. If you found this video helpful, don't forget to hit the like button, subscribe, and turn on the notification bell so you never miss a new Nclex review video. Comment below with your favorite question from today, or let me know which cardiac topic you want us to cover next. We read every comment and love helping you succeed. Remember, consistent practice plus understanding the why behind each answer is the key to Nclex success. Keep studying, stay confident, and I'll see you in the next video.